Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and we have an excellent show for you today. It's awesome. And I am so glad that we're able to bring it to you because we're going to talk about a particular topic. I want to tell you what it is. It's so exciting. We're going to talk about living wills, and we have the perfect person to talk about that topic. But before, let me talk about sharing and caring. Remember that med moment. Remember those med moments, guys. Those moments that let you know that you should go see your doctor. That knee pain, or that, oh, my gout is acting up, or hey, that's not chest pain. I was walking up the stairs and I just couldn't make it. I got so short of breath. Those are med moments. Let your body letting you know that you should check out your doctor. Call him up, make an appointment, go see your doctor. All right, guys. All right, let's talk. I want to talk about a particular topic that's a favorite of mine. The reason it's a favorite of mine is because I feel that proper nutrition, and the proper weight for your height is the key to good health. I truly believe that. So if we can decrease, those of us that are overweight, if we could decrease your weight, you would decrease hypertension, diabetes, it would be colon cancer, heart disease. So many illnesses would decrease you would decrease the chance of acquiring those illnesses. And if you have them already, guess what? The likelihood that you may need to take medicine for it, or a lot of it corrects on its own. So let's decrease that weight out there, all right? So I want to talk about micronutrients or macronutrients. And macronutrients are fats, carbohydrates, and proteins, okay? Now, if we're talking about your meal, fats should be about 30% of your daily intake of what you take over the whole day. Carbohydrates, which are things like bread and pasta and those things that have a lot of carbs, a lot of calories in them. Okay, that should be about 50 to 65% of your meals, and protein should be about 25% of your plate when you fix it. Okay, so these are some of the things that you think about when you sit down to eat. All right, let's get to the meat of what the show is all about today. We're going to talk about living wills. And living wills are so important because I don't care who you are, one day, even myself, it's going to come to a point where I'm going to need assistance in the hospital. I'm going to need somebody to speak for me. And I think each and every one of us should take care of this prior to that serious illness. Don't wait and have your family members trying to juggle and figure out what's going on and where things are. You should take care of this before the illness happens, while you have all your faculties, while you can think. This is so important. So I have the perfect person to talk about this topic tonight. His name is Judge Theodore Stevens. We have a judge. Here come the judge. All right, Judge Theodore Stevens. He's the Essex County surrogate. And Judge Stevens, welcome to our show.
Thank you very much, Dr. Bey, for having me. It's an honor to be here.
Oh my goodness. Listen, I am so glad you took time out of your busy schedule to come and talk to us about this so important topic. Okay, so what we're going to do is I'm just going to get started but before I get started, remember, this is a very, very important topic. And before we start talking about it, I want to make sure I say that you should check with your doctor to make sure, and talk to your doctor about living wills or advanced directives, please, just to start off with that. So, Judge Stevens.
Yes, sir.
What is a living will?
A living will, Dr. Bey, is a name that's commonly known, but it describes several different documents. Mm-hmm. For instance, it includes advanced directives and also healthcare proxies.
Okay.
Now, an advanced directive is one where the individual has made certain determinations about very serious medical periods in their life. They're done way in advance, so of course they can't cover everything, but you cover especially like the end of life sorts of things you can anticipate, whether or not somebody wants to be on cardiopulmonary resuscitation.
All right, like that's that. You mean things like if their heart stops, whether they want pumping on their heart.
Exactly, whether or not they want that. And otherwise, if they want experimental drugs to stay alive.
Oh, okay.
If they want to, if they're on life support, whether or not, how long they want to stay on life support, a minimum period of time or an elongated period of time, or for until the doctor says it's definitely time to pull the plug.
Now we're going to define some of these. When you say life support, you mean that machine that keeps breathing for you.
Exactly.
And like the kidney machine, if you need dialysis and things like that.
Those are prime examples of it. Yes.
All right.
So
Excellent.
that the person would make that decision because they know, or they have an idea, because we don't really know. You have an idea of perhaps how long that they want their body to suffer, or whether they anticipate pain or something. So they make those decisions up front.
Right.
But obviously, nobody can anticipate every condition that would befall them. So what the other half of that would be the healthcare proxy, where they are designating an individual to help make decisions for them in the event they're unable to make the decision themselves.
Okay, so a proxy is somebody who you select
Yes.
to act or speak for you when you can't speak for yourself.
Exactly. That's exactly what it is.
That's what a proxy is.
Exactly.
Excellent. Now, I know we're talking about living wills, but and advanced directives, are they sort of the same thing?
Well, the living will is the name that kind of encompasses both of those documents.
Okay. All right. Now I understand. All right. We're going to step back for a second.
Sure.
Now I know that you're a judge, but I don't understand legal things. I'm going to be very honest with you. Sure. I'm a physician, and legal is like, it blows right over my head. So we're going to step back for a minute. Surrogate court, Judge, explain what you do.
But
explain to me.
Don't feel bad about not knowing what the surrogate does, because nobody else does either. Like, I made it a mission to try and expose or expand on the public's information about the surrogate's court.
All right.
In a nutshell, I'm a judge, and I'm the only elected judge in the state of New Jersey. The surrogates are. There's one in every county. Right. Our primary duties are the probate of wills and the administration of non-will estates, which means that once somebody dies, the person who's going to be in charge of their estate has got to be empowered by my court before they can take over and do their job.
And this is very, very important, because we're talking, see, I'm a critical care doctor.
Okay.
And I am on the other end of a lot of my patients get well, but there are a portion that do die.
Sure.
So I see the families going through this if a will is not there.
Yes.
And it really becomes very complicated sometimes.
Very
So
much so.
I didn't mean to break your thought, but continue.
Sure. Well, you're right, and I know you want to talk about wills a little later on, which we should, because that's each parts of an estate plan, if you will, extremely important. We're going to concentrate on living wills today, though. Right. So, but what we do, we don't deal with living wills per se in the surrogates court, but we always refer people to where they can get them. Some are actually, there's some state-generated forms that are on the web people can get, and otherwise we refer people to attorneys in order to get the information they need to put it together.
Right.
Because as you're saying, with wills and with living wills, which often get confused one or the other, you can see why, but obviously the living will really just deals with healthcare issues, as opposed to the will itself, which handles the administration of your estate once somebody passes on.
Right, I understand.
And then, of course, there's the non-will people die. Most people die without wills. Right. And then that's generated, or it is determined by state law. And so that person would be called an administrator. That person also has to get appointed. Only a blood relative has a chance really to be an administrator. And see, that's the beauty of the will. The will, you can choose the exact person you want to serve to be your estate representative. Right. Otherwise, it's going to be limited to a person who's related to you by blood or your spouse. That's the only non-blood relative who would get a chance to handle your estate.
All righty. That was explained well. Boy, oh boy. Now, let's just start talking about something that we have, and I've seen this document many times. It's called 5 wishes.
Yes.
Could you explain the 5 wishes document to us, just basically, and then we'll go through what the 5 wishes are?
Sure. Well, the 5 wishes is probably the most popular type of living will out there.
Okay.
It is a form, essentially, that has been developed by some very committed individuals working in conjunction with lawyers. In fact, the American Bar Association was heavily involved with that. And they developed this document, which is so widely used. I believe it's used in 42 states around the country.
Okay.
And so it often is the only document which individuals see where they get an opportunity to make both of those elections, an advance directive and also a healthcare proxy.
Okay.
So they can choose an individual to serve as their proxy. In fact, they really should choose more than one individual, because if it's a document worth putting together, you really want to have an alternate just in case the primary is not around. Otherwise, all that effort is gone for naught.
All righty. Now, there are several things that this 5 wishes document. Well, number one question is, where can you get it? Can you get it at hospitals? Can you go online and get it? Where can somebody get a document
Well,
like
both
this?
of those. You can get it both places.
All right.
And you can get it at the hospital, but I really think it's much better for an individual to be prepared and to get it in advance.
Okay.
And it's not the sort of thing, as you can imagine, that most people want to do in advance. You have hard enough time having people come in for advanced checkups, right, for
true,
preventive. So,
true.
as you've just said, if something hurts, come in.
Right.
Often individuals think about it when they're getting ready to have a very serious operation or procedure.
Right.
But I counsel people that while I don't do estate planning now as a surrogate, it just as a friend to give some advice. I mean, it just makes sense. You'd rather do something in advance, because if you know that important operation or that procedure is coming up, what are you thinking about? You're probably thinking about that procedure as opposed to who should be my healthcare proxy.
Right,
So it's better to do it in advance, much better.
Okay. Well, all right. So what we're talking about, I know the number one wish is that you want to make a decision as to who can speak for you.
Sure.
All right. How do you determine how to make that decision? You know what I mean? Is there a formula? Should I choose Uncle Johnny, or should I choose my brother who is, who should, how do you make that decision?
Well, look, that is the critical question, the one you just asked, because choosing the right person is everything.
Right.
And you need a person who, one, is going to be dutiful, who's going to abide by your wishes, but someone who you have a rapport with, where you have to discuss with them what your desires are, because that person is much less effective if you've never discussed what your future plans are, what your desires are. So if that person knows, they're in a much better position to make a decision on your behalf.
Okay. And you were talking about choosing more than one.
Yes.
On the form, how many choices do you have?
At least 2, and maybe more than that, but it's at least 2, I know that. And that's usually adequate, but I'm sure if you want more than 2, I'm sure it'll accommodate that as well.
All right. What if, as time goes on, Uncle Johnny and I have a falling out?
Oof.
Can I get rid of him on my form?
Yeah, I know Uncle Johnny, that could happen.
Maybe I shouldn't have said Johnny, right? I should have said
Whoever,
Uncle Louie.
Uncle Bob, whatever,
Uncle Bob,
right? Yeah, sure,
Those Uncle Johnnies out there are going to be like, yeah,
Yeah.
don't be using my name that way.
Well, your point, though, is extremely well taken.
I hear you.
You can change it. And there's often any number of ways to do it. One, you can strike that and actually destroy it. Or in many cases, people can't find the document.
Right.
And not to worry, it's usually going to be superseded by the most recent document.
Okay.
So if you have 2 and they show up together, the more recent one is usually the one that's given priority.
Okay, all right. Now, all these questions are coming to my head right
Sure.
here. Once I have this document, who do I give it to?
Well, you should give it to the individual who's going to be your agent, the person you choose as your proxy.
All right.
They should have it. But your doctor may need
your
it
doctor,
as well.
okay.
So copies usually are acceptable. Doesn't always have to be an original.
Okay.
But you should be able to put your hands on the original just in case that signature is needed.
Okay, so what about if you have a lawyer, should they get it?
Sure, that's one of the individuals.
What about that handy safety deposit box that I have?
Well, safety deposit boxes are tricky.
Okay.
It's great to have one especially for your cash. But you need it for you to put your document in there. Sometimes that's great to do as well.
Right.
But it's often, as you know, there are only so many people can get into the safety deposit box.
That's right.
So if you haven't put another person who is that trusted advisor, their name is not on the ledger, and they don't have the key, then they may have the limited or no access to it. And then once again, you've got this perfectly good document that's sitting in there nobody can get to. So we usually, when I was practicing in the area, I would recommend that people find a very safe place in their home, either a locked desk drawer or at least a place that normally only important documents would be found and people would know that's where they should look for it.
All right. So if I'm having this procedure, whatever the procedure is,
Sure.
should I bring a copy with me to the hospital?
Oh, yes.
Yes. That's just a yes.
Absolutely.
All right.
Yes.
Because tell me why. Because you think the physician is going to need it? Will the hospital need it? Who's going to need to see this though?
Well, these are just in case, documents. What if something happens?
All right.
So usually if the patient is, or the person is conscious, is in their right frame of mind, they're able to make these decisions for themselves. And in that case, the 5 wishes really would not come into play. It's only if, in fact, they lose consciousness or in some state where they're unable to really care for and make their own decisions, that's when this individual has been designated to make decisions for them, or the document will state exactly what the patient wants.
All righty. Now, this document also allows me to determine which medications I want, right? The type of treatment I want, and does it also determine the type of treatment that I don't want as well?
All of that can be in there.
Okay.
But again, in only broad strokes, because nobody can anticipate all of the very varied types of choices that might benefit their condition.
Okay.
So again, it's a combination of especially indicating in the 5 wishes or any living will the things they don't want. If you don't want the experimental drugs, if you don't want to have your chest pumped in order to stay alive or to be on a respirator for a period of time. So then the healthcare proxy, the person who you've designated who will help the doctors determine what to do based on what the things you would have wanted. And of course, that's based on the conversations that they've had.
So it seems like to me, the way you're talking about this, the person really has the right. The doctor actually, in situations of critical illness, we have to kind of go to the family and see what they want, or go to the patient, or we really need feedback from the family to actually treat the patient.
I would think that was beneficial in most cases, certainly from a lawyer's point of view, that the lawyer would want to know if wishes have been stated in advance, what those were. And the main thing that the 5 wishes does is it designates the individual.
Right.
So you don't have to go to the whole family, because in those situations of crisis, you could have a waiting room full of family, and then a key person who's been designated to make that decision, to be the decision maker for the family. That's beneficial usually, I think, for everybody.
Okay. What about comfort care? All righty. Well, there are many levels of comfort care. All righty. Some people, they just knock me out, doc. I don't want to know.
Right.
Well, another person's like, well, they don't take an aspirin.
Sure.
So how do we handle that in this document? Does this document allow us to regulate the comfort care and for the person to actually go through comfort care and understand it so they can say what they want?
Sure. That's a big part of the document.
Okay.
In fact, I guess from what the studies have shown, the individual's comfort may be their primary concern that they really want to have designated or stated in advance.
Okay.
It even goes so far as some individuals who would elect a DNR, do not resuscitate. So in other words, I don't really want to have these life-sustaining medical treatments. I just want to be made comfortable. And so some people say, let God's will or nature take its course as they will, but they want to make sure that they are as comfortable as possible through the process.
So is there an association with all of this? Is there an association with hospice? Hospice is like one of those situations where the patient is critically ill, and you would refer them to a hospice so they could be comfortable.
Sure.
Is that part of this, or is that a separate entity that we would have to explore later?
No, the thing about the document is it would travel with the patient through all ends or all stages of their medical condition.
Right.
So that the same individual, it's usually not limited to say that this doesn't include if I go into hospice, or it only includes if I'm in the emergency room. It usually is holistic enough to cover all of those circumstances.
Okay, so no matter what type of institution, if you're in a nursing home, if you're in a hospice, if you're in a hospital, it will pretty much cover, this will cover you from that standpoint of what you want at end of life.
Well, if it's properly written, it should cover all of those circumstances. It's intended to do so.
Right, right. All righty. What about how people relate to me and treat me during my sickness and during my illness? Can you designate how you want to be treated? Maybe say, I want the minister to come by, things like that. Does it help you as far as that's concerned? I want to, be respected, even though I'm in. Can you say those type of things on it? Because that means a lot. Well, put it this way: to me, it would mean a lot.
Sure.
You know what I mean?
I understand.
I think if I filled this out, that would be my number one. This is how you treat me. You know what I mean? But does that cover that?
Well, and the 5 wishes, comfort, of course, is part of it, as we talked about. Usually it doesn't go into whom I want to be around me to help comfort me through this condition.
Right.
You know, the important aspect of it, and I keep going back to it, is that healthcare proxy. Because that's the individual who usually knows the person so well, they know who they want at their bedside, who's going to help to make their getting better more comfortable, or make it better for everybody, comforting the family as well.
Okay.
So that proxy, putting the person in charge is usually the most difficult part of families. I get people who come into the circuits court every day, and they may not have a will, and there's several kids, and they fight among themselves who's in charge. Right. And they say, Mommy loved me best. And I say, well, Mommy should have had a will, because Mommy should have put you in charge, because that's really the only way for us to know what the person's wishes really were.
Right, right. Now, what if and I find this in medicine, especially when someone's in the ICU and you're really talking to them, and it's a tough time for the patient, and actually, if you really think about it, it's a tough time for the doctor as well, because you know what I mean. This is real tough stuff when you're talking about end of life stuff, and sometimes the patients, there are situations or illnesses or different diseases and things that the patient may not want the family to know. Does this cover that? There are certain things.
That's a tough situation right there. And in terms of that, the main benefit is that because the entire family is not involved in the decision-making process, it's still limited in terms of the interaction. Right. So that becomes, what do they say in the old days, on a need-to-know basis. Right. And so oftentimes, there's not a requirement of confidentiality for the healthcare proxy that there would be for a doctor or there would be for a lawyer. Right. But nonetheless, most people, again, they've spoken to the person. They know if the person's a private person, they would try to make sure that their needs were covered. Right, right. Okay. All right, then. I just want to cover this because I want to get to, we're running out of time here. Oh, really? I know time goes so fast. It really does. But you know what we're going to do? We're going to skip a few things in it because there are several things that I want to cover. Okay. I really want to cover. So let's see about this. In a hot second, there's something called the pulse. Yes. All righty. And this is the New Jersey practitioners' orders for life-sustaining treatment. Yes. Explain this to us. Well, that's a relatively new phenomenon here in New Jersey. The governor signed a law in 2011, became effective, I believe, in 2012, which is a tool that helps in the medical planning process. Right. It kind of goes along with an advanced care directive. It doesn't necessarily have to be, but it can go along with it. Right. As I indicated before, the advanced directive or the living will is done usually long in advance, sits in a drawer. This is something that's developed a lot closer, more contemporaneously with the medical treatment that needs to be done. And it allows for a plan to work, hopefully together with the living will in order to aid the patient.
All righty, all righty. Power of attorney.
Yes.
Okay, tell me about it.
That's a business document primarily. That's one where you've designated that agent to really handle business for you, go to the bank for you, go to MVC for you, and that also sits in the drawer, usually done in advance. And all of these documents, as you talked about earlier, they can be superseded, they can be revoked, so people don't need
Revoked means
done away. Tear it up.
You can tear it up.
Get rid of it.
It's gone.
No longer has any value.
File number 11.
Right. So because individuals get a little concerned, people get concerned. I gave this to someone.
Right.
Can I get it back? Yes, you can always rescind it, revoke it, tear it up, whatever you need to do, or change it. Just as the person either gets older, they win the lottery, they go around the world trip, you never see them again, whatever. You can always replace them.
I got you. What about beneficiary designations?
Well, that's something that, I'm sorry to say that a lot of professionals, your profession and mine, often overlook, and as everyone else does. But people have, whether they're IRAs or have bank accounts, where they're able to designate somebody who will take those funds after they pass on.
Okay.
Now that's in the surrogates court, there are things called probate assets and non-probate assets. Real quick, an asset that can only be given to the beneficiary based on what the will says or what the intestate document says. Without a will, that's a probate asset. But insurance policies where there's a beneficiary, that's a non-probate asset. That goes directly to that person. But if you haven't designated that beneficiary, then it won't go. It becomes a probate asset.
It becomes part of the estate.
Part of the estate in general. So we encourage everybody, make sure you fill out that beneficiary designation so it goes where you're intending to go. And review it, because as people get older,
they may want to change.
That's right, exactly.
Oh my goodness, we covered it all, man.
We just scratched the surface. That's it.
I know, we're just kidding. But the show goes so quickly,
really
and
does.
I'm so glad you came on to cover this, because this is such an important topic. Oh, Judge Stevens.
Listen, I'm honored to be here. Thank you so much. I appreciate it.
Thank you for coming in.
My
All
pleasure.
righty. All right. Well, let me end up here. Let's say, in closing, remember, sharing and caring. Guys, share with each other your med moments, and listen, all you, I should say females out there, take that man of yours by the ear and drag him to the doctor, because we should all get regular checkups. So drag him in, okay guys? All right, never institute any change in your medical care until you check with your doctor. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.